Hello, hello. Welcome back to Ana Ono's In the Dressing Room, the series where we highlight our incredible mastectomy boutique partners that carry the collections of Ana Ono and help to serve our community. I'm so excited today to introduce a store in Oregon, Remember the Moon, and its incredible store owner, Andrea, who has just an awesome history and story personally, but also what drove her to be excited and to get empowered to help other cancer patients in her local area. So thank you all for tuning in with us. I know it's early on the West Coast, so hopefully we'll grab a few of you. And it's heading into your lunchtime over here. So we're excited to have Remember the Moon here with us today. And as you tune in, maybe you're hopping in and out, but please feel free to ask any questions, send any love, and of course, we'll continue to have the conversation on what exactly is a mastectomy boutique. I think that this is a really important conversation, mostly because a lot of patients don't even know that mastectomy boutiques are in their area and can help them A, get fitted, but B, help utilize their health insurance benefits following a mastectomy. So important. If you do have one, seek one out in your community. We have an awesome store locator at Ana Ono, so if you want to make sure that you find a boutique that carries us, please check that out at anaono.com. And of course, if you have a boutique in your area that is not carrying us, we always love a little bit of love and name dropping, if you know what I'm saying. And you can help support those in your local community by bringing in our collections. So hopefully we'll get Remember the Moon on here at any minute. You know, these are live, so who knows what the technical difficulties may be, but I'm going to request this way. And I think that she might be here, and we'll welcome Andrea and we'll hear a little bit about her story. So very excited to introduce her to you all. I think she's just really a rising star and so incredibly special. And the way that she gives back is really empowering. So I'm thrilled to be able to cover this topic with her. And there she is. How are you?
I'm good. How are you?
You look beautiful. Did you cut your hair?
I did. I was done with it. Thank you. Thank you.
Good. Well, I was just raving about you and your store, about how incredibly fabulous I think that you all are out there in Oregon, and just the awesome work that you do for yourself and for the community and for all that you serve. So welcome, Andrea, to our series In the Dressing Room. First of all, P.S. by the way, prettiest dressing room I've ever seen my entire life. It looks like it's out of a magazine. It's so gorgeous. It's so amazing. But let's kick it off. Tell us, how did you get into owning a store that serves your community, and especially the cancer patients that come into it?
Well, I was diagnosed with non-Hodgkin's lymphoma in 2013. And I had a brain tumor. You know, the type of cancer I had was statistically for men over the age of 60 with some sort of autoimmune disease. So I didn't fit into that category, but whatever. You know, as with anyone, when you hear that you have cancer, I think death immediately comes to mind. So, you know, with that, I had, you know, everything went very quickly. I just turned 40, had brain surgery, and that went through inpatient chemo for 6 months. But, you know, just during all of that, I had an amazing support team. You know, I had family and friends. And, you know, you do a lot of reflecting during those treatments and lying in the hospital bed, and it's just like, whatever, I have got to finally, you know, I've had all of these dreams forever, and I am 40 and I might be dying, so let's, you know, get it together. So I just, you know, and I had a wonderful like meal train that was set up for me. But I my thought was initially, I want to create some sort of nonprofit and have this, provide meals for people that don't have the support team that I have. Because how terrible to go through this alone, and so many people do. So, I don't know what, the stars aligned. And when I was finished with treatment, I was just telling people that I wanted to do this. And then turns out our local cancer center just, had people approach them that had just started this nonprofit, Positive Community Kitchen. Anyway, so I started volunteering there. And then I was working for Enterprise Rent-A-Car at the time. So, and I was able to do that from home. But I knew that was not my goal. Anyway, so worked for the nonprofit. I eventually quit working at Enterprise. I was a waitress for a little bit. And then I got a job with Willamette Valley Cancer Institute, which is our community treatment center. And then, I worked with all cancer diagnoses there as a patient navigator. And, I just was really providing resources and comfort and, seeing the patient from initial diagnosis through to the end of treatment. And of course, that looks different for everybody. But within doing that, we had a local business called Cynthia's Fine Lingerie. And she had been in business for 33 years. And I really just one day, it was like all of these breast cancer patients I see, I have this flyer for Cynthia's and I'm going to send them there. So I was actually talking to our social worker and, did she know Cynthia? Had she ever been there? And I had planned to just go visit Cynthia, meet her, see her shop, see where I was sending all of these patients. And the social worker shared with me that day before I was going to meet her that, Cynthia, she wants to sell the business. She's looking to retire. And I was just like, oh my gosh. So I had that in my mind when I went to see her. That wasn't the plan initially, but I met her that day. She showed me around. I told her what I did and why I wanted to meet her. Just shared life stories. And am I frozen?
You're frozen just a little bit, but I can still hear you. Can you hear me? Oh, there you go. You're back.
Anyway, just, exchange stories. She was not a breast cancer survivor until 7 years into her mastectomy business. So anyway, I told her, I really think I want to do this. I can continue doing this patient navigation. I can provide the Positive Community Kitchen resources and all of the other things that we have in our community to breast cancer patients. But then I also, having just a good positive body image for women in general, I wanted just like, what a better place to help keep that alive or started or, something for a lot of women that already struggle with that. Anyway, so I was able to get an SBA loan. It was a miracle. Like everything, like I had rented the space and committed before I had got my certified mastectomy fitter training, before I had the SBA loan. I was going for it. And it's working, but yes, it was amazing. So it was rough, but yes, I'm just so excited to be here and be able to serve people and have a place that they can come and be in the pretty dressing room and, just feel good about themselves and, get their, life back on track, or at least the start of it.
Well, like your cosmic boom is like, I think that, why we connect on so many levels is just like, it was all of these like levels of unfortunate circumstances that show up at the same time. Like here you are getting out of your treatment for the lymphoma. You seek out patient navigation, which we know how hard that job is and just how big your heart must be to help patients navigate this crazy world called cancer. To then meet Cynthia and see like, here's this opportunity where like your personality, your creativity, your huge heart, like everything that you're doing, right, just kind of like can come together. And you like just the pictures that we'll be posting later as we do our recap, they're so beautiful, this store. And in our feed today, I love how you like think about merchandising your offering as well for these clients to be like, you know, like sometimes you got to be a little tongue in cheek. Sometimes we got to pick ourselves up off the ground. Sometimes we can't be all straight up serious. So like, get your shit together. Like,
right. Yes.
come on, let's just do that.
So where is that? Shoot,
I love it.
That.
It's like the best doily in the world.
It's somewhere. I'll show it later.
Show it later. But yeah, I think that just, you know, it's so interesting to me, this taking this lived experience that you had, right? And some of the things that you encountered, even though not a breast cancer patient, but still a cancer patient. We all have needs as we go through chemo. Different levels and different types of surgeries are happening depending on your cancer diagnosis. Obviously, mastectomy, we'll dive into that a little bit later. But what I love about your story, just how you met Cynthia, similarly to like what I say about our mastectomy bra collection, like it's no longer your grandma's mastectomy bra. And God bless Cynthia for 33 years ago, seeing a need to service these patients in her area. And like, they are this beautiful generation of mostly women that came together and said, we need to help like women feel beautiful, feel empowered. I mean, regretfully, they used to say feel whole again, which I have a very big complex about. I'm whole with or without my breasts, but I get it. I get that side of the conversation back then. And because cancer wasn't spoken about like it is today. And I love how you took sort of the rules of engagement and you've made it not your grandma's mastectomy boutique.
Right.
Which is a beautiful thing. So tell us, like, what do people expect and experience inside your store?
Well, my favorite thing is that, you know, of course, you know, I just chose this color on my walls. I don't know if you probably can't see it, but it's Bora Bora Shore, but it's blue. It's like this color, all the walls. Beautiful. Anyway, which I find soothing, but I just wanted to create a space that when people walked in the door, they really just had a sigh of relief. For one, I mean, so her store was in this beautiful, historic pink house, which I, first thought, oh, I'm going to keep it there. But it was very old and it had a lot of structural things. And I just thought, no, this is mine. I'm going to move it. I live in Springfield. Our little main street is really cute. Used to be all strip clubs, but no longer.
Hey, cities evolve as well.
Yeah, yes. So, and her store, I mean, it was definitely cozy. But it just, when I was in there that first day, just was, looking around thinking, man, there's a lot of beige bras, like beige, beige, beige everywhere. And I just thought, I know, maybe there's nothing else out there. Maybe, maybe that was just it. And you just get beige. But as I started, with my own inventory, and I think I met you. Were you in New Orleans at Juzo? Yes, yep. That's when I met you. And saw your bras, and I was like, well, hello. Like, these are fantastic. And they're youthful, and they're comfortable, and, I mean, anybody can wear them. I mean, that's one of my favorite things is when a 70-year-old woman, picks up one of these.
Oh, yeah, she's my favorite shopper. I love her.
Yes. And she's just like, oh, I want, just want to feel sexy and look sexy. So I knew just sitting in Cynthia's, like, I know I have to keep, these clients happy, the ones that are used to what Cynthia offered, but I also want to open it up to so many more women. And even still, I've got to take a drink of coffee.
That's okay.
I don't have I want more young women to know about me. And I'm getting there, but I'm kind of going off topic. I want my store to be a haven, non-clinical. I don't want it to be sterile. I want women, even though I know they're not exactly, but I want them just to feel like I'm going shopping today and I'm going to buy pretty things and I'm going to, come out with all these new treasures and feel and look beautiful. So
100%. And like, this is again, like the evolution of what is a mastectomy boutique? And, you know, I was diagnosed in 2010, and I don't know if you saw my post I put on my personal page, but like, honestly, if I walked into that dressing room when I was diagnosed and I didn't walk into the library of beige mastectomy bras that was available in 2010, the era of Cynthia, like, I might have never started Ana Ono. I mean, that's really the reality, is like, I started this because everything that you've created and everything you're setting out to provide to patients is like what I so desperately needed in that moment. I needed to feel like myself. I wanted to not like get pulled out of a world where I used to shop from bras and then be plopped into a world. And there's, oh, did I freeze again, or can you hear me?
I can hear you.
Okay. You'll come right back. That's what happened last time. But yeah, so it's, you know, I think there's just this reality to say that we were looked at for a very long time as a medical need for patients. And I think that what you're doing is you're redefining and recreating that space and that experience so anybody can feel comfortable coming into your store. Because the reality is after cancer, like, yes, we're different, but we don't want to feel different. We already know in the deepest of our hearts that things aren't right and things have changed, but do we need to be constantly reminded of that? And my answer is no.
Yeah, right. Yeah.
Kind of simple. But, you know, I think that that's just so awesome. So since, you know, our community and our audience are mostly undergoing breast surgeries or breast cancer, what can the breast cancer patient that comes into your space, what can she expect? What services do you have available for her? Products, health insurance, all of that juicy nitty gritty?
So we offer a lot of things, you know, compression. I mean, a lot of things that women don't know they're going to need.
Correct.
So
I always say you don't know until you know, and that's always usually a little too late.
Yes.
Yeah.
So I am trying, you know, I do have a good connection with a lot of our breast surgeons, and then we get referrals from them, but I'm meeting with them and bringing products so they can see and touch and feel all of them, so that we get the women in here early. I mean, I would love to have them in here before they have surgery, so that I can show them we have wigs, we have compression garments and they have never heard of the word lymphedema. They have no idea that, you know, removing your lymph nodes may, you know, cause these issues. They don't know insurance pays for, you know, anything. I mean, I just had a woman yesterday, and it happens quite often, that she's gone like 11 years wearing a jelly that I do not know, but she just called it a jelly. It looked like a jelly. It was wrapped in saran wrap. Oh. And she was gluing it to her skin. And she had no idea that her insurance would pay for a prosthesis every 2 years, bras every year. And I just want to go scream it from the mountaintops. And then, you know, I need the doctors and their staff to be like, and I have a sheet that I'm going to give all of them, like, just give this to them. It has all of the products that we have. And go there, because it's a great resource and it's going to help you through all of this that's coming, and you don't even know what's ahead. But here's a little love and practical products to, you know, get you through.
So important. You're right. Like, I want to, again, when we send out an email talking about health insurance benefits and directing us to all of our DME and mastectomy boutiques across the United States, like, we have customers that scream at us and they say, why did nobody ever tell me this?
Right. Yes.
It's such a lull in our medical care system. And we really, you know, doing things like this is super important. I can guarantee you somebody will watch this and say, what do you mean health insurance covers my bras or covers my breast form? Yes. So when it comes to after the diagnosis to utilize those health insurance benefits, can you just give us like a top 3 pointer? What do patients need to have prepared in order to come to you to make sure that they can really optimize their visit, but also be able to use their health insurance?
So I mean, it's pretty simple. They just call us and schedule an appointment. And once they do that, I hopefully can get an email from them, and I send them, what to expect at your first appointment. And I just outline, first of all, just greeting them and making sure that, this is a safe place for you to come. Sorry. And the most important part is that I'm going to ask you about what brought you here. Because, some women are really eager to share, and some women, they're fighting back tears. And so if I tell them ahead of time, we are going to sit down, have a conversation so I can, really figure out what you do need. But all they have to bring is their insurance card.
Okay.
I mean, so, we get their, all of their information. I do encourage them to call their insurance just to see what the benefits are, so they can even just start that process of talking with the insurance company, because it's a delight. And then we call too, so we know their benefits and can show them. So it's really, it's very simple. Just again, in terms of it's very simple for us to, get their information and bill insurance. And then, we mostly deal with all of any insurance issues that might come up, but it's pretty straightforward for the products that we carry.
Do they need to come in prepared for a prescription, or are you able to call the physician to get the prescription that you need once you know what products they're going to need to get through their treatment?
Yeah, some women just come in with them, and sometimes that's why they're here, is because their doctor did give them prosthetic and bras prescription. But yes, if they come in and they don't have one, we can reach out to their doctor and get that for them.
Amazing.
So that's easy to do. So even if someone does just walk in off the street, which happens sometimes, and they don't have a prescription and they don't have their insurance card, that's all doable. We can still do the fitting and, get all those details later.
Amazing, because everything I think that we've spoken about is covered by health insurance, which means mastectomy bras, mastectomy breast forms or prosthetics. That includes any balance forms or partial forms or other forms that are needed. We've talked about that in a series that we have with Studio One about custom breast forms.
Yes.
And then compression garments and wigs, correct?
Yes. Yeah. Okay. Wigs are a little tougher, but, certainly, some insurances do cover.
We just actually got a great question. Do you take over the phone orders from Mutant Strong?
Absolutely. Yes.
Okay, great.
Yes.
And that would be, so you could help them if they can't make it into the studio, or they can't make it into the shop, you can talk to them on the phone, give them a fitting, talk them through what they need, and be able to assist them?
Yes, great. Absolutely.
Yeah. Amazing. So I think that what I love too about how you have helped position the community in your services is you work a lot with mastectomy, but also reconstruction and aesthetic flat closure. So let's talk a little bit about the experience when those with reconstruction or flat closure come into your store, and what's different about their experience?
Well, I meant to tell you this, that is, I do see them, but my goal is to get those women specifically in here. And for the flat closure, in our community, it isn't like in Portland, which is 2 hours north of us. I know there's one for sure, plastic surgeon that does that, aesthetically flat closure. And that's a huge education for women that I want, ask your surgeon for this. Yeah. Because you're not getting it. Anyway, so I want a lot of education for flat closure and for reconstruction, for women to know that we can bill insurance for your bras too. And most of the reconstruction women that I have had in have been, usually they're younger, and, they're getting a compression bra for, whatever reason, if their plastic surgeon recommended that, or a physical therapist possibly. So really, other than the educational piece, I don't think I mean, your bras are fantastic for so many reasons, but I love them because you also point out reconstruction. You can wear prosthesis. You can be flat. You can have one breast and be flat on the other side. And it's just all inclusive. And it gets the story and message out there that, you can do anything like you want to do, whatever makes you, feel confident and pretty. So I think I would approach all of them the same way, but just, giving them all the options. But mostly I want to educate our community, which I'm starting.
Well, you're doing fantastic. We're going to help you with that because it is such a different change and shift. I think a lot of this too is like, you're not coined as a mastectomy boutique, but I do feel like there is a hesitancy of those with reconstruction or flat closure to think that they also belong inside a mastectomy boutique. And,
yes.
And really the reality here is that if you do have this benefit for health insurance, this is really how you optimize the care and some external elements by being able to really utilize that benefit. And I kind of say to people, I'm like, after your mastectomy, your deductibles probably met.
Yes.
So,
yes.
so
yes.
For year one, you're in a really good shape. Year two, if your surgeries go into year two, you're still going to really have the benefit. But even if you don't meet your deductible, usually the fees or charges are quite small. So you might be able to get a bra for $8 or $10 or $12, depending on how your medical has sort of added up in time. But Kat just asked a really great question. Do you have any services or provide any services for those that are underinsured or not insured at all?
Yes. So I will take any sort of payment plan for one, but we have some resources just within our community. So Oregon Cancer Foundation is a nonprofit that provides money to, the only requirements is that you're going through any cancer treatment in Lane County. So that's really helpful.
Great.
And that's like $500 that they give. And then there's another local nonprofit, the Seroptimist, which is a national organization for empowering women, but they have a local chapter that they also provide funds that are for gynecological and breast cancer specifically.
Amazing.
Through Willamette Valley Cancer Institute. So if somebody comes in and just, they can't pay, I reach out to them and coordinate all of that. And so, that's what we have here locally. But then again, payment plans are great. Because I really want the women to have the products.
That's amazing that you could be so flexible in order to support the additional care and needs. And I think you also said something really important earlier. So we talk a little bit about how kind of going into these stores is part of this process of sort of working through the trauma. It's a lot of women can feel very nervous. I've done some pop-up shops and boutiques when I very, very early started, and even inside Ana Ono, to be honest. And there have been patients that have come up to me and said, I was never going to come here because I was too nervous. Right. And I think that this is a very, very real feeling. And like you said too, like how you kind of allow time and space to let them know that you're going to be sitting down to talk a little bit about things, I think is so important. Because I remember walking into the mastectomy boutique, getting greeted by a much, much older woman. I was 27 years old at the time. So, she could have been 65, but it felt like 80. And she's like, oh, honey, what are you doing here? Like, are you here for your mom or your grandma? And I'm like, I'm here because I have breast cancer and I don't have a bra that fits. And I'm losing my mind. I'm like melting down inside the store. But like the store associates at that point in time were like, it's you, like you're the one with the problem. And I just like, that was like my first interaction. And like, it was kind of the first time I told a stranger that my tits were chopped off my body.
Yeah.
Like, it's really, really impactful, this experience. And so the fact that you kind of warned them that we're about to sit down and talk to this, but share with us a little bit, like, how do you help us remove that level of saying, I don't know if I'm ready, I'm too nervous, I haven't talked to a stranger, I don't even know what's going on with my body? How do you coach us through that process?
I just think that you can sense, or I can, when someone, doesn't want to talk about it, or, I just sometimes just allow them, even though they know that we're going to have this conversation.
Mm-hmm.
And, they were tearful on the phone, because I can hear them, holding back their, tears. But, I keep notes of that. I know that this client is coming in. I know she was tearful on the phone. So, when she comes in, and my employee, Adria, as well, like, whether she's talked to the client or I have, I say, like, remember this woman, she's nervous. She was crying on the phone. She might be crying when she's in here. So, and that specific woman, was like, as soon as she, came in, sat on our couch, and, then, the floodgates just open. And I know with my cancer, you just don't know when that's going to happen. Like, I think I'm fine, and then all of a sudden have a complete mental breakdown. Mm-hmm. So I always know that that might happen at any time. But I just, allow them to, let it out and just, comfort them and give them time and, let them know it's okay if you're not ready today. We can make an appointment and you can come back. So I just tell them verbally, like, I know this is hard, but, we have all of these wonderful things, when you're ready, we are here for you. So that's my approach.
And like, I'm sure just like your patient navigation too, as a background is so important to that overall training that you also share with your staff. Cause I know your staff is also incredible, and that comes from, the top up. So I know that you're instilling those ideas and support and love and empathy into everybody that works for you. And I think that that's so awesome.
Thank you.
So what, now that we've talked about your services, is there anything that you kind of wish that the patients knew and I know that's kind of like a big question, but like, what do you wish patients knew before they either came to the store or how to find the store? Like, what would be some like important words of advice if you could catch them early?
Well, I would love for every woman, like at our cancer clinic, that if they have breast cancer, and they actually, usually they end up seeing the surgeon first, but whoever they see first, I want them to say, there's a resource for you to, work on making your way through this decision-making process for what you're going to do. Because I just don't think, I think that, and I'm pretty sure this is true, that you're getting, a mastectomy, a lumpectomy, bilateral, whatever the case may be, and here's the plastic surgeon. So they just go there instead of go to Remember the Moon, and you can, see all of your options. But I know from working with doctors, for one, they're not trained to do that. They're trained to get rid of your cancer, or they're trained to, plastic surgeon is going to fix it and make it pretty. But they don't sit down, most of them, and take that time to say, this is a huge, but I guess that's what I would want to say to a woman. Like, having cancer, just knowing that is overwhelming. Mm-hmm. But, it's going to be different than you ever imagined it was going to be in, different ways, but just get all of your information up front if you can. And that's another thing, is that they're overwhelmed with so many appointments, but this one is a big one because you get to touch and feel the products, and I want them to do what they want to do. But, if they're going to get reconstruction, fantastic. And here are some Ana Ono bras that will, you know, that you get to look forward to wearing. So that they know that, I guess knowing beforehand that you can come out the end and still feel good about your body and yourself. And you know, I don't know if that's.
No, listen, I have chills. I have chills right now because I am like sitting here, like ready to like climb out of this chair because I have I have lots of soapboxes, but one soapbox is that I think of, first of all, therapy should be included in the treatment path for everybody diagnosed with cancer. This should not be here's a therapist if you want to. It should be, here is your next appointment booked tomorrow at 9 a.m. to speak to a therapist.
Yes.
And that should be like, this is heavy shit.
Yes.
You're not prepared to process it, period, end of story. Secondly, though, it's like how brilliant and how important to say, if we could really get the boutiques involved in the community, which listen, what you're sharing is what so many boutiques have shared with me. Like we keep going to the hospital, but they don't even know we exist. And you're right. The doctors are there to cure or treat the cancer. And I think that this reality to say, can you imagine if you were that patient that said, I don't know what I want? How do I know? And then they say, go talk to Andrea at Remember the Moon. Learn about your options. Because, and I'm getting chills again, so is Lori, Studio One. She's here too. So like fangirl club, boss babes everywhere. And to say like, because then you could come in and you could say, you know what? Here's two options when you decide to do nothing. One, the breast forms. We have these things called FOOBs, and you can do it lightweight, you can do it heavy, you can do it custom, you can have it, you can wear it when you want, you can wear it when you don't want, you can go flat, and here's all these beautiful bras that, I'll do a little product display here, that lay flat, beautifully flat against your body where you can still feel expressive. You can have reconstructive surgery where there's no underwires and da-da-da-da-da. So that way, you know, here's another selection of bras that you can wear afterwards. And, you know, I've seen a lot of patients because maybe HIPAA, maybe not HIPAA, but you could say, oh, I have a patient coming in later. Maybe I can connect the two of you.
Yes.
Like it's almost like a community space where you have access to so many different moving parts. And hey, if you're going to have chemo and you want to look at wigs, you can come back in and look at wigs, and, you know, like, and then they get an education as a part of that process because we don't know. We, as a patient, everything I encountered was new. I had no idea what was happening to me.
Yeah. No, and this is one of my soapboxes is that insurance, I mean, they don't know, like have struggled with one particular insurance not being able to get in network. So I finally asked them, like, where can this woman go? Where can she go? Because I'm in her town. But where can she go that, you know, she can get a prosthetic? And they gave me this Tuality Medical Supply. And I just knew by the name. I was like, well, that's a DME shop. And they don't even sell them. I mean, they don't even sell them.
Well, next to the bedpans and wheelchairs,
Yes. And a man will come and give you a box and say, but they can't even do that because they're not even there. So, you know, that's a huge, like the fact that prosthetics and bras are under the durable medical equipment umbrella. I mean, it's great because we can bill insurance, but, well, I mean, if I had a full DME shop, it would be luxurious and lovely as well because nobody wants to walk into those either. So, anyway, that's a side note, but yes, lots of education and just so much we could do to make the experience better. And for the woman to feel so much more confident instead of just like, I have no idea what I'm doing. You know, I'm going in for surgery and hope I come out the other end. I mean, I want to provide way more than that.
Oh yeah, I'm blasting this in PS. The Booby Docs are here, who are an awesome group of docs. Not too far away from me. They're amazing, but like they're here getting educated and informed, right? So like I'm sending this to all the plastic surgeons, all the breast surgeons, everybody in your area, because this has been so empowering. And Kat actually asked another great question. She told us we're talking too much about bras, which is
Oh.
usually my habit. But I do think this is a great way. She sort of stole my last question from me, but it's a really important thing. We're talking a lot about bras, but the needs of today's patients has changed. Do you have any other, I see some like pajamas and some things in the background, but what other sort of items are available there that are either for those customers that aren't wearing bras? I don't know, maybe I believe you have some of our camisoles. You always have access to our camisoles, but we have loungewear, etc. But anything else you want to kind of promote a little bit before we wrap up?
Well, I am wearing, I don't know if that you can see this, but I'm wearing, and I don't know what the name of this one is, but I just got it for myself the other day. But I love your underwear. I love them. And I'm wearing your lounge pants as well. So really,
go to work in the lounge pants. It's my favorite.
So I really wanted, when I was going through treatment, like just the stuff that I wore, like to, you know, have access to your port. So I have a lot of, you know, just soft, cozy wraps, whether like that's kind of a shawl with a hood, but it has pockets, but they're great for sitting in the chemo chair. So, I mean, your lounge pants, I mean, I wore bandeaus like all the time through treatment just because, I don't know, I did. And you know, your port, the strap doesn't. You know, just loungy, soft. I do have pajamas, swimming suits that, you know, are pocketed for prosthetics, and some just easy like blouses that button too, that you can, you know, undo if you need to get access to your port, you know, all of those sorts of things, and scarves and earrings and, you know, just accessories like, you know, life beauty accessories.
I love that. So the best present I got when I was diagnosed with cancer was from a fellow colleague of mine that I never knew had breast cancer. And she got me this gift. It was in this beautifully wrapped box, and I opened it up, and it was a button-down shirt from Anthropologie.
Oh.
And I thought to myself, I'm like, well, this is really nice, but it seems a little out of left field. Like, why are you getting me a work blouse? And she said to me, she goes, well, because after your mastectomy, you're going to want something really loose so you can hide the drains. And you're going to want something that buttons in the front because you won't be able to move your arms for a while. And I looked at her and I was like, what? And that was the first time I had learned that I wasn't going to be able to dress myself with the clothes I had in my closet. And I still literally have that shirt to this day. I still wear it all the time. And I will tell you, I wore it at least once a week after my surgery, because I had to keep working. So I only took like the 2 weeks off for my mastectomy, or 3 weeks off for my mastectomy, and I was back at work. So it was just a whole all-encompassing that I'm so happy that you have those, because again, these are things that you don't think about until it's too late and you don't know. So that's amazing. All right, so let's wrap up. Please share with us, is there anything we missed? Is there anything you want to share about Remember the Moon that we didn't cover?
Well, I was going to say this is a product, but like the post-surgical camisoles that I also don't think physicians necessarily know that are covered by insurance, that do the drain management. You have great, you know, your robe with the drain management is lovely, because I know people go online and buy stuff, they don't like it. So I have that here. I can't bill your robe, but I can bill the camisoles that have that drain management. And then, you know, I also really want people, because everybody wants to know, what do I get this person, my loved one that's going through treatment? And you can come here and buy them. I mean, we'll put together a package for you. We have them on our website, that like a chemo package, a radiation package, and we can customize it for you. And then, you know, you just buy it and give this lovely bag of love and support to your loved one. So
I love that. I was actually, when you were getting ready to talk about the drains, I was just saying, any caregivers out there, people that are tuning in whose loved ones have just gotten diagnosed and they're wondering, what is a mastectomy boutique? How do I get to a mastectomy boutique? I love that you can just hear a story and you can make a beautifully little crafted goodie package. That's so amazing. Because listen, there's only so many fruit baskets you can eat, and there's only so many flowers. And please, please, please don't go shopping for all the things that have a pink ribbon on it, because the patient at home does not want any of those things.
Yeah.
So this has been amazing, Andrea. You're so, so incredible. How do people find you? Give us all of them. Obviously, follow Remember the Moon here on Instagram. You must show her some love. But how do they call, email, schedule appointments, all of that good stuff?
So we have our website is up. It's rememberthemoon.com. We also have a Facebook page, which is Remember the Moon. We're located in Springfield, Oregon at 347 Main Street. And you want our number?
Go ahead, drop that phone number.
541-34. I'm going to have to get it right. 345-9204. So,
perfect.
Yes,
well, we'll have all of your contact information. Yeah, we'll do all the contact information in the follow-up. Just before we wrap up, I'll give you my virtual hug, because I just love everything that you're doing. And let's see if we freeze, but I want to see this dressing room before we go.
Oh, okay.
Can we move? Can we mobilize?
I've packed it tight with products that are not usually in there. So, yes. Oh, my gosh. So, let's see.
Oh, those walls are beautiful.
Yes, there's the top. Oh, dear.
Oh, were we literally in the dressing? We were literally in the dressing room.
Yes, we were in it. I made it a fort. Yes.
I love it. I love it.
Yes.
Well, your store is absolutely beautiful. Thank you so, so much for doing this with us. We can't wait to share with our community. And please just remember that Ana Ono is available at Remember the Moon. She has access to the full collection. So if you go and you don't necessarily see your favorite bra, she can absolutely order it for you at any time, even ship it directly to your house. So we're so, so thrilled to have you as a part of our store partners. And thank you, Andrea, for being so amazing to all of us in the community.
Thank you so much. Thank you.
We'll see you later.
Okay, bye.